Hello everybody, this is Dr. Gita Mathai and this is my Health Vibes channel. Today we are going to talk about facial palsy. What is facial palsy? Well, most of the people, their faces are very symmetrical, but sometimes suddenly for no reason at all, one half of the face starts to droop. There's drooling from the mouth, tearing of the eyes, and the cheek doesn't move. The eyes remain permanently open. When the person tries to speak, the speech is slurred and it becomes very difficult to understand them. People get very scared when this happens and they think that they have been affected by witchcraft or somebody has put a curse on them. But this is called facial palsy and it is because of paralysis of the 7th cranial nerve. The 7th cranial nerve comes out from the skull near the ear and then supplies all the muscles of the face. It can get affected at birth, in which case children are born with one side of their face paralyzed but nothing else affected, and their one eye is open, so they also look very bizarre. Then it can be because of a head injury or a trauma, ear infection, it can be part of a generalized stroke, or it can be because of infections. The most common infections are virus, the herpes virus, Coxsackie, or the flu virus. Once a person comes with facial palsy, they may say, I suddenly woke up and one half of my face is paralyzed. Or they may say, I have some tingling and numbness on one side of my face and by the next morning it was paralyzed. Facial palsy usually occurs between the ages of 15 and 40. It occurs equally in men and women. It can occur more often in pregnancy, but it can also occur in childhood and in old age. Now, once the facial palsy has occurred, it has to be evaluated. The person has to be checked for diabetes, hypertension, obesity, and then CT scan and MRI of the brain should be taken to rule out a brain tumor or a tumor of the nerve itself. Most people recover from facial palsy within 1 to 6 months. By the time they become dejected, the face slowly starts to recover. But how can you treat yourself? First of all, apply moist heat to the face. Second, consult a physiotherapist who will teach you exercises so that your eyes close and your facial muscles work again and are retrained. The eyes must be protected because the eye is permanently open, it can be damaged. Ointment must be applied to the eye and at night a shade should be applied. Electrical stimulation can be tried to make the nerves grow faster. If it is due to a virus infection like the herpes virus, then antiviral medication along with steroids will help and make the recovery faster. Sometimes when the person recovers from the facial palsy, the nerves do not go back to the original muscles, but they go and attach themselves somewhere else. So when the person tries to close one eye, the other eye opens, or when they try to smile, instead the lips droop down. This can also be tackled by physiotherapy, and the person can learn to re-educate the muscles and the nerves of the face. But this is a slow, laborious process and it will take a lot of time. How can you protect yourself from getting facial palsy? One thing is not to have a cold wind suddenly affecting your ear. Second is to make sure that you are not obese, your diabetes or hypertension is controlled, and you exercise regularly so that you have good immunity. Herpes virus is one of the commonest viruses causing facial palsy. Varicella or chickenpox is also caused by the herpes virus, and many years after getting chickenpox, you can get a recurrence called herpes zoster, which if it occurs in the facial nerve will cause paralysis. Chickenpox is prevented by immunization and vaccine is also available for flu, but it has to be taken every year. Immunize yourself, stay happy, stay healthy, and don't worry if you get facial palsy. Treatment is available. This is Dr. Gita Mathai signing off. This is my Health Vibes channel. If you liked what you heard, please subscribe to my channel and press the bell button. The same content is available in Tamil. Thank you.